Hello everyone and welcome to MedVize TV, where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, we're going to talk about congestion versus congestion. Yes, that's a little confusing, but it's because there's a lot of people that are congested and they go to the pharmacy and they don't know exactly how to treat their congestion. There are a lot of products at the pharmacy that treat congestion, but the problem is, how do you know which congestion you're treating? Sometimes it's not very clear, so I'm here to clear it all up, pun intended. There are two types of congestion. There's nasal congestion and then there's chest congestion. And the medications to treat each of these are completely different. So you cannot use a chest congestion medication for your nasal congestion. It doesn't work. It just doesn't work like that. So let's start with nasal congestion. Nasal congestion can be the result of many different things. It could be from having a cold, it could be from having the flu, it could be from allergies, or it could even be from some sort of sinus infection. Treating nasal congestion can be done with pills, it can be done with nasal sprays. Sometimes you could use the thing called the neti pot, where it's like you put a solution through your nose and it kind of comes out through the other way. It's supposed to clean it really well, and I don't really personally like that thing. I tried it once, it's super awkward to use. Some people love it though, so it works really well for some people, so definitely worth a try. But it's not something I recommend, only because I personally just really don't like to use it. So I'm mainly going to talk about the pills that you can take and the nasal sprays that you can use to treat your nasal congestion. They're all different, and picking one depends on your particular situation and your personal preference. Some people will never use a nasal spray in their life, so obviously that's not going to be a good option for you. You're only going to benefit from the pills. Some people don't care, they just want to treat it as best as possible. So I'm going to go over all the different scenarios about when to use what. So my go-to for first treating nasal congestion is a nasal spray called Afrin. Afrin works really well. The active ingredient is whatever. The name is super complicated. I'm going to put it up here. I know I'm a pharmacist and I should be able to say that, but that word is difficult and I'm a human being. I don't know who these people think they are making these names. Anyway, oxymetazoline. There it is. That's the word. Afrin is super effective in treating nasal congestion. It is a nasal spray. However, it does have some drawbacks. Being that it is a nasal spray, one of the most common side effects is nasal irritation. Sometimes you could have nosebleeds, itching, feeling tingling in there. The other thing that's important to note about Afrin is that you actually can't use Afrin for more than 3 days. And a lot of patients come to me and tell me that they have nasal congestion and nothing's working, and I ask them what they're taking, and they've been taking Afrin for like 3 months. And that is a huge no-no. And the reason is because Afrin is only good for using for short periods of time. If you use it for more than those 3 days, you actually run the risk of bringing back your congestion like to be 10 times worse. It's actually technically a side effect of the medication called rebound congestion. Sometimes people call it being addicted to Afrin, and it's because they're using the Afrin and it's working for a little bit, and then the congestion just comes back so much worse and they think they need to take more, and it forms a sense of addiction. But it's really a side effect called rebound congestion. So Afrin is great, but it's only good if you're only going to be using it for 3 days or less. Now, it's not to say, you can use it for 3 days and then you need it like next month, you can do another 3 days, that's fine. You just can't use it for more than 3 consecutive days in a row, because you have the potential of running the risk of the rebound congestion. So my next recommendation, especially if it's for treating congestion that you're only going to be using for a short term of treatment, is a medication called Sudafed. Now, Sudafed is great. It works really well. The active ingredient in Sudafed is called pseudoephedrine. Usually you could only get it from behind the counter because it's technically a controlled substance, because a few years back there was a huge problem with abuse of Sudafed, because people were buying the pseudoephedrine product in large quantities in bulk, doing a chemical reaction and turning it into something called methamphetamine. So because of that, the government has put a lot of restrictions around how much you can buy per month, even per day. You have to show your license, you have to sign papers and things like that. So it's a little complicated to buy. Now, because of this, the company Sudafed, the brand Sudafed, they came out with another product called Sudafed PE. And it's really kind of done a disservice to most customers and to most patients, because Sudafed PE, which you can buy over the counter, you don't need to get it from from the pharmacist or anything. It's a medication called phenylephrine, and it doesn't work. It flat out doesn't work. And the reason is because it doesn't get fully absorbed into your system. In theory, the medication does work if it actually got into your blood, but there's been a lot of studies out there that's shown that very small amounts is actually absorbed into your system, which doesn't give it a chance to work. So A lot of people that take it says it doesn't do anything for them, and it's because they're absolutely right. That medication does not work. So do not waste your money on a Sudafed product that says Sudafed PE or any product that has the phenylephrine in it if you're using it for decongestion, because it just the studies show it just doesn't work. Now, the real Sudafed, the original Sudafed product, the one that contains the pseudoephedrine, whether it be brand or generic, the one that you get from the pharmacist, that one works really well. So this product, Sudafed, the pseudoephedrine, is technically a stimulant, so it can have stimulant-like side effects like increasing of the heart rate, it can increase your blood pressure, and it could also affect your ability to go to sleep or stay asleep at night. Because of that, I would recommend that if you are going to buy a Sudafed product, there's one that's every 4 hours that you could use. And then there's one that's like an every 12-hour one or even a 24-hour one. So I would be careful with taking the 12-hour one, because if you take it too late at night, you have the potential of, affecting your sleep. Whereas I really like the one that's every 4 hours, because, you can take it maybe kind of towards the evening and maybe it's still not have an effect on your sleep. But even after taking this medication after 5 o'clock, there's still a potential where it could affect your sleep. So just be careful with taking Sudafed. Also, if you have uncontrolled high blood pressure or any other sort of heart conditions like arrhythmias, you want to make sure you stay away from using the Sudafed product, because it's a stimulant. It can increase your heart rate and it could cause some potential issues. So if you do have health conditions, you're going to be better off with going with the Afrin, like I spoke about before, or the other nasal sprays I'm going to talk about next. Now, the last recommendation I have for treating nasal congestion is using a corticosteroid nasal spray, such as Flonase or Clary spray, or what's the other one? Nasacort. So Nasacort, Flonase, or Clary spray, or the corticosteroid nasal sprays that you can use that can treat your congestion. None of these sprays are actually better than the other. I would just look for whatever's cheapest and start with that one, because sometimes one could work really good for you, but for someone else, it might not work as good. So just pick the cheapest one and try to see which one best works for you. Steroid nasal sprays are great for if you're treating something that's very long term, because you have seasonal allergies or even year-long allergies. So if you need to treat congestion that's over a long period of time, the nasal spray is going to be the best thing for you. Again, because the Afrin, you're limited to 3 days. And then you have those side effect issues to worry about with the Sudafed. You can actually take all these together. So if you have some really severe congestion, you can actually take Sudafed with the steroid nasal spray and the Afrin. It's just important to know that if you're using the Afrin, it can only be for the 3 days. And if you are going to use the Afrin with the steroid spray, make sure to use the Afrin spray first before you use the steroid spray, because that allows the Afrin kind of really opens up your nostrils to allow for the steroid spray to go in there and do its job. The reason I don't recommend first to use the steroid nasal sprays is because it actually takes 1 to 2 weeks for the corticosteroid nasal sprays to fully work at its maximum capacity for you. You can actually use these nasal sprays, these steroid nasal sprays, for like all year. You do run the risk of some of the side effects that come along with it, like nosebleeds and like irritation to the center of your nose there. So sometimes if you do have to use it year round, it is good to take breaks, but it's not like the Afrin where you're limited to 3 days. You can use this steroid nasal spray every day. All right, so now that you're a pro at treating nasal congestion, we're gonna move on to chest congestion, which chest congestion is actually way more complicated, so buckle up. Just kidding, it's really not that complicated. There really is only one thing that's available to treat chest congestion that's available over the counter, and that's Mucinex. Picking a Mucinex product, though, can be super confusing because there's all types of Mucinex products out there. However, you just want, when you're picking your product for your chest congestion and you're trying to buy Mucinex, just look for what says Mucinex. Don't get the Mucinex DM. So Mucinex is actually an expectorant. It works to thin the mucus that's located down into your chest and in your lungs, thins it out so you can cough it up and get rid of anything that's in your system. And it's important to realize that Mucinex, coming with all these other products, one of the other products it comes with is Mucinex DM. That DM part is a cough suppressant, which it's kind of counterintuitive because the expectorant wants you to cough and get everything out, but then the cough suppressant stops the cough. So you got to see like which one is it, which one do you want? So I usually recommend if you have chest congestion and you have like the stuff you feel like you need to get out of you, just get the one that just says the Mucinex. so you can get all that stuff out of your system. There's not many side effects that are associated with Mucinex, and it's normally taken by everyone pretty safely. The only thing that is a drawback about Mucinex is there's not many studies that show that it actually works really well. So there's no like real proof to show that this absolutely works, and it's just unfortunate, but it's really the only option that we have though. If you are looking for an over-the-counter medication to treat your chest congestion. However, if you have chest congestion and especially if you're like coughing or wheezing or anything like that, or if you have shortness of breath or a history of asthma or COPD, you definitely will want to talk to your pharmacist or your healthcare provider about it and not just try to treat that alone with the Mucinex because you might need a prescription medication. So if you do have that chest congestion, there is wheezing, or you have the history of asthma, COPD, make sure to contact your pharmacist or your healthcare professional because you might need an extra prescription medication. So that's all I have for today. As always, do not start or change the way you use any medications without first talking with your pharmacist or your healthcare provider. Thanks for watching. Take care.